Hello everyone, my name is Asmaa Ibrahim and today I'm going to talk about phosphohistone H3 antibody counterstained with hematoxylin and eosinr to improve precision in counting mitosis as part of breast cancer grading. Mitotic score is a key component of breast cancer grading and it's a strong predictor of survival. However, it is the most time-consuming component to assess and is also constrained by low inter-observer reproducibility. The poor reproducibility of mitotic scoring can be attributed to several factors. The most important of these is the detection of mitotically active regions, or what is called hotspots, or the presence of mitotic mimickers, such as hyperchromatic nuclei or apoptotic cells. Histone H3 is one of the five histone proteins, and all together form a major components of chromatin in normal cell. Antibodies against phosphohistone H3 are almost exclusively expressed in actively proliferating cells during the mitotic phase of cell cycle and the late G2 phase. The function or the utility of PHH3 has been evaluated in various tumors, like CNS tumors, neuroendocrine carcinoma, ovarian cancer, and in all it has been correlated with the outcome. Using H&E alone cannot reflect the presence and distribution of underlying specific antigen within the tissue, just as any immunohistochemical markers and PHH3 expression alone, it cannot be evaluated adequately without the context of tissue morphology. These dual staining techniques enable visualization of the morphology in addition to the molecular profiling within the same tissue section, and thus improving the overall accuracy, diagnostic precision, and the quality. Another advantage of this approach is that computational stain separation can be performed on these dual stained images, resulting in two different images, one stained with H&E only and the other stained with IHC. This technique can be used for a computational pathology-based biomarker prediction algorithm directly from these dual stained histopathological images. These are a few examples of the reconstructed images from the dual stain, where we have removed the H&E stain and remaining the IHC stain only. Combining both H&E and IHC on one section can achieve an optimal method for mitosis detection and counting in breast cancer. And the dual staining of breast cancer in tissue section with PHH3 and H&E will improve the concordance of mitosis scoring and the overall grading scheme. In 97 cases, we cut two full face sections, one stained with H&E and the other was stained with PHH3 and the counterstained with H&E. Then pathologists counted mitosis using both techniques and compared to each other in terms of reproducibility, scoring time, and the ability to detect mitotic hotspot areas. We then assessed the agreement between manual and image analysis assisted scoring mitotic figures using both H&E and PHH3 stained cells. The diagnostic performance of PHH3 in detecting mitotic figures in terms of sensitivity and specificity was measured. And finally, PHH3 replaced mitosis score in a multivariate analysis to identify its significance. Our results showed that pathologists were able to detect significantly higher number of mitotic figures using the PHH3 H&E stain compared with H&E alone, and the agreement between them in identifying the mitotic hotspots and the mitotic figures was highest when using these dual staining techniques, as it highlighted these figures at low power at ease, allowing better agreement on choosing these hotspot areas. Also, a better agreement was found between the image analysis assisted softwares and the human eye for PHH3 stained mitotic figures. And finally, when we replace the mitosis score with PHH3 in a Cox regression model with other plate components, PHH3 was an independent predictor of survival and even showed a more significant association with breast cancer specific survival than mitosis and Ki-67. So, to our conclusion, histopathological diagnosis of tumor depend mainly on H&E and IHC, and these are the gold standard in clinical care. We are here developing a new technique that combines both H&E and IHC and can be tissue and time saving while improving the diagnostic quality and a more sensitive approach to train artificial intelligence model for prediction of IHC on the same exact slide. Our result demonstrated a tendency to underrate breast cancers based on H&E compared to PHH3, which can alter the stage, risk of the disease progression, and treatment recommendation. Therefore, we showed for the first time the potential of using PHH3 counterstained with H&E for precise routine mitotic scoring in clinical practice. Using PHH3 stained slide can reliably be used in routine scoring of mitotic figures. And by integrating these both techniques and both approaches can compensate for each other's limitation and finally improve the overall diagnostic accuracy, quality, and precision. Thank you very much for listening, and I hope it was beneficial. Thank you.